The Ebola outbreak in West Africa is the worst ever epidemic of the virus since its discovery 4 decades ago. According to the World Health Organization, the scale of the problem has been vastly underestimated and extraordinary measures are needed to contain the disease.
Well, the death toll has risen to 1,145, with Liberia, Sierra Leone and Nigeria declaring national emergencies. Catherine Noble has recently returned from Dakar in Senegal, where she works as the head of regional resource mobilisation for the aid agency Plan. She joins us now from Melbourne. Catherine Noble, thanks very much for joining us this morning. Let's just look at this overall crisis. Now, as we've just heard, the WHO said that this may have been vastly underestimated, this crisis, and in fact MSF, the relief organisation, has been highly critical of the way that this has been conducted as far as certainly the WHO is concerned. Do you also have concerns at the way this crisis has been managed?
Not in terms of the way the crisis has been managed. I think what happened was there was a very slow response initially, but now aid agencies are extremely mobilised. Governments are now recognising these are national emergencies and are taking immediate action. So we're now responding. All countries affected. We're working, Plan International is working in Guinea, Sierra Leone and Liberia, working to really raise awareness of the crisis and working with national and local governments to really take preventative action.
Catherine, can you tell us what the main difficulty in dealing with Ebola is obviously the fear of contamination. How do you get around that specific issue?
Oh, look, fear and anxiety is real in the region, of course, but fear is not going to prevent the further spread. What is needed is concrete action and indeed global action. Early investment in weak public health systems, as well as investment in the response itself is needed. Basically, financial resources are needed by all agencies responding and working with the governments and the countries affected.
Certainly a lot of it has been concentrated this past week, on the development of a treatment, be it a vaccine. Certainly the mention of ZMapp, where only a few people have been treated with that particular what's been available. Would you say that the most critical point at this stage is to actually develop hygiene methods to contain the disease, rather than coming up with perhaps a vaccine or some sort of treatment in that regard?
Oh, look, first and foremost, I'd say that I'm not a medical expert. Obviously, action is being taken to develop the vaccine, and while it hasn't been licensed and distributed further, people are taking action in that regard. But you've hit upon the key issue there around prevention, and this is exactly what countries and aid agencies are doing at the moment, is around prevention measures. So sanitation, hand washing is really going to be the key to further spread. So containment and that prevention is only possible through education, awareness raising, mobilising the community to inform others in order to stop the further spread. And that will be what will really curb the further spread of this horrible disease.
So what action is actually being taken on the ground now?
So as I touched upon, what's happening is aid agencies are really working closely with local and national governments affected, and coordination is the key. Agencies responding now are coordinating tightly on their response, and because misinformation and a lack of coordination is really an enemy of the spread of the disease, if you like. So strong coordination between actors, as well as in terms of community mobilisation and getting the message out there. Education, awareness around how the disease is spread, tackling misinformation and rumour, and looking at concrete steps that communities can take in order to protect themselves, as well as distribution of, as I said, hand sanitisers, disinfectant and so on, to really protect the communities and to stop the further spread.
Catherine, how do you combat the rumour, the misinformation, the fear that you speak of, particularly in Africa, where there is, quite frankly, a lot of suspicion, particularly when Westerners are involved in trying to treat something like this?
Well, look, our misinformation, as I said, is a real problem, and which is exactly why the approach is one of communication with the community, mobilising the community, informing community, who in turn inform others. It's not around Western aid agencies reaching out, but rather these are local staff, local organisations, and working with local government and national health ministries in order to get the message out there. So a real coordinated, organised approach to getting information outreach through communities in local languages, recognising local cultural structures and how information is best spread in order to really prevent the further outbreaks and increase in the outbreak.
Have you spoken to people who are actually on the ground in those countries where the death rate is high, and what are they telling you about how people are reacting to this increasing epidemic?
Yes, so I work very closely with our teams in Liberia, Sierra Leone and Guinea, and indeed countries throughout the region who are also taking preventative steps. But those countries dealing with the outbreak currently, very proud of my colleagues responding in the country offices. Teams there are highly motivated and focused on preventing the further spread and reaching the most vulnerable, to looking at how the outbreak affects children and communities. And so my colleagues at Plan International are on the ground responding. What we're hearing is that while we're responding, working with local health authorities, outreach to the community, mobilising community to inform them about how we're responding, what we're hearing is that basically there's a lack of resources. There's a real lack of investment in public health systems, weak public health systems, and there's a lack of resources to respond to the current outbreak. So that is a message I'm hearing from my teams in the region and who are responding, is just how they're coping with limited financial resources.
Catherine Noble from Plan International, thanks very much, and we wish you well with your work.
Thank you very much.